Thank you for joining us for the inaugural 2016 Patient Experience Awards, sponsored by the Health Quality Council of Alberta, also known as the HQCA. My name is Rindal and I'm the project lead for this Patient Experience Awards program here at the HQCA. I will be the moderator for the webcast. For those of you on Twitter, our hashtag for today is PE Awards 16. I would like to extend a sincere thank you to the four judges, Dr. Tony Fields, HQCA Board Chair, Annette Mickelson, Director, Project Office at the HQCA, and Joan Embry and Darlene Gallant, members of the Patient Family Safety Advisory Panel at HQCA. To give opening remarks is Dr. Tony Fields. Dr. Fields has been HQCA's Board Chair since 2012. Here is Dr. Fields.
Thanks, Rhonda. And on behalf of the Health Quality Council of Alberta, I welcome everyone warmly, and I thank you for joining today's webcast to celebrate the inaugural Patient Experience Awards program. This program was sponsored by the HQCA and our Patient and Family Safety Advisory Panel. For those of you who may not know, HQCA is a provincial agency that pursues opportunities to improve patient safety and health service quality for Albertans. It gathers and analyzes information and collaborates with patients, with Alberta Health Services, health professions, with academia, and other stakeholders to drive improvements to quality and safety in the health services sector. This past year, we determined that it was important to have a program in Alberta that would recognize and celebrate the wonderful work by healthcare providers and teams that is improving the patient experience. And when we say patient, we really are including anyone who is receiving healthcare services, including clients, residents, and their families. Thank you to everyone who entered a submission. We were delighted to receive nearly 50 applications. This great response demonstrates that the patient experience is truly becoming an important focus in the delivery of health services in Alberta. This, of course, is only the first annual Patient Experience Awards event. We look forward to hearing about many more innovative patient experience initiatives in the coming years. The submissions that were selected to receive the 2016 awards show the dedication to being patient-focused, and they demonstrated that their work is truly making a difference to the patients they serve. I now look forward to sitting back and listening to how the teams are making this all possible. Thank you.
Thank you, Dr. Fields. We will now move into the four presentations that were selected to receive an award. We will have a 5-minute question and answer period at the conclusion of the four presentations. You in the audience are invited to submit your questions along with the name of the presenter you are addressing your question to in the chat area on the webcast screen. It is now my pleasure to introduce Shane Byrne, who is the clinical lead for the Stroke Support Program for Medicine Hat and area. Shane?
Thank you. Background, early supportive discharge. Medicine Hat was chosen as one of 5 centers to receive pilot funding for an early supported discharge, stroke unit equivalent care, and community rehabilitation team in 2014. This funding came from the Alberta Health Services Strategic Clinical Network for Cardiovascular Health and Stroke. Medicine Hat was successful in achieving permanent funding in 2015. Our ESD initiative promotes timely access to intensive rehab within the community for adults with mild to moderate stroke and facilitates an early discharge from hospital. We accept referrals for clients living within a 1-hour driving distance. Slide. SUEC and community rehab. The other 2 initiatives of our team include Stroke Unit Equivalent Care, or SUEC, and Community Rehab, or CR, as described on this slide. Our team has helped our acute care HQCA counterparts in determining how they might increase therapy hours to their stroke patients and support the adoption of best practice guidelines like depression, swallowing, and cognitive screening. We've also offered training in functional electrical stimulation use after stroke and in supportive conversation for aphasic clients. Our remaining initiative is community rehab. Clients receive the same level of therapy as in ESD, but is meant for those clients whose stroke was at least 1 year prior and are at risk of requiring more care. Improving the patient experience, the model. The stroke support team consists of an occupational therapist, registered nurse, physiotherapist, speech-language pathologist, recreation therapist, social worker, 2 therapist assistants, a clerk, and a clinical lead. Each client is engaged from the beginning as to what they want to be able to achieve before ESD therapy is completed. Then, the pertinent health professionals assess the client and use their expertise to feed in treatment ideas into the client's goals, and a therapist assistant is assigned to the client and carries out the majority of the treatment in a transdisciplinary method. That means that the TA or any other staff member going in is providing all facets of the interventions as suggested by the array of health professionals. With this assignment of one main staff member, we find great rapport building and consistency in care. Next slide, the reality. Clients must be willing and able to tolerate at least 1 hour per day of therapy and up to 3 hours per day as per their tolerance. Each client participates in an assessment called the COPM, which is the Canadian Occupational Performance Measure, which is a standardized assessment for establishment and reassessment of client goals, and the team scores the client on the AUSTMs, or Australian Therapy Outcome Measures, at weekly rounds. A depression screen is completed on every client by our nurse or social worker within the first few weeks of the program to ensure that we are arranging appropriate follow-up. Weekly team rounds keep us all on course regarding client care. Improving the patient experience, real world. We believe we should treat real world problems with real world experiences. So these clouds show you all the areas in our community that we've provided direct therapy to our clients in. Currently, we have a client who wished to camp every weekend starting Friday afternoon during his time with the stroke support team. Our team offered to come to his local campsite and continue therapy in order to maintain his intensity. He was flabbergasted and stated there is no other program out there that would do this for a person. As you can see, these are very unconventional places relative to hospital or outpatient-based rehabilitation services. Our clients' goals determine the best location for our therapy as the practical application makes therapy real life and builds confidence for the client and their family. Some examples of therapy we have done in the past include practicing sit-to-stands and kneeling in a client's own church, riding special transit to the Petro-Canada for coffee with friends. One of our therapy assistants has helped an aphasic client use supportive conversation at his follow-up appointment with his doctor, and to purchase fence post for his ranch at the UFA store. We've also made a point of ensuring our transition of our clients' lives goes smoothly. To do this, we have on occasion taught incoming home care and brain injury relearning services staff how to continue to help our clients in a meaningful way. ESD client achievements. So because of these interventions, our clients have been able to achieve the following. They've regained methods of communication. They've discontinued use of mobility aids and other equipment such as raised toilet seats and tub seats. They've regained a hand and arm function so they can return to independent self-care or meal preparation. They've returned to previous leisure pursuits, or we've helped them explore others such as bowling, golfing, knitting, computer, art, swimming, and kayaking. We've helped them return to work and explore other roles such as volunteering or school. We've helped them return to driving and practice use of public transportation. And a lot of our clients have also had significant lifestyle changes through our intervention, such as reducing salt, changing dietary practices, reducing or quitting their smoking, starting to do daily blood pressure monitoring, increasing their activity for their general cardiovascular health, and learning how to manage life stressors. The team. We were given processes from other ESD teams in the province when we first started. We have since made a multitude of changes for the betterment of our clients' care and the team's efficiency. We've changed the timing of the introduction to goal setting to enhance our client engagement, created goal setting cards for clients struggling with memory or insight issues. Our client binders have morphed into tools for both the present therapy and later for a stroke resource. We review client goals for SMART principles and language level prior to copying goals into client binders for their reference, just to name a few. We've linked with other community and inpatient rehab programs such as the Alberta Healthy Living Program, home care, inpatient rehab, and our stroke navigation nurse to ease the burden of calls to our clients within the first 2 weeks returning home with our team. Our entire team has built knowledge in best practice guidelines for stroke rehabilitation and the health change approach model to ensure any one of us has the competencies to help our clients and their families. Transdisciplinary model just doesn't happen overnight. Our staff have taught one another about their specialized areas and determined what intervention strategies could be done by anyone with appropriate cross-training so we could limit the number of staff in and out of clients' homes. We've had team members learn about each other's strengths and tendencies through insights discovery training, which has also reinforced to us that we are capable of addressing any inefficiencies or quality issues at the grassroots level because we all believe that those clients should get our best efforts. The quote on this slide is from one of our staff. They said that seeing the progress in our clients is amazing. The transdisciplinary team format allows us to cover every aspect of an individual's rehabilitation, and the intensity helps an individual build skills faster. As a therapist, I saw clients make gains that I never thought were possible. The findings. This slide illustrates the effect of the stroke support team on Medicine Hat healthcare. At the time of our application for this award, we also had 100% of our clients scoring at least 2 full points higher on the Canadian Occupational Performance Measure and at least 1 full point higher on 2 areas of the OSTEMS, or Australian outcome measures, from admission to discharge, which is showing a statistically significant difference. Client feedback. As you can see, the reports from clients and caregivers have been overwhelmingly positive. Some clients have even reported that the strategies and involvement of the stroke support team has made their health, both physically and mentally, even better than prior to their stroke. In line with always trying to improve our process, we are now piloting an in-home qualitative survey with clients 2 weeks into the program, and then again 1 to 2 weeks following their ESD discharge. We have anecdotally found some clients feeling overwhelmed 2 weeks into therapy, so we developed the 2-week in-home survey to measure the frequency of this and to see if our assumption is right, and help us determine if there are ways to ease this challenging time for the client and caregiver. Success can be contagious. In Medicine Hat, the adoption of a transdisciplinary model and client family-centered care is occurring in our outpatient pediatric program and in our Medicine Hat Regional Hospital Restorative Care Unit's Allied Health team. They are trying to model exactly the same team that we have out in the community. Thank you.
Thank you, Shane. It's now my pleasure to introduce Lori Beaver, who is the Patient Experience Liaison for the Peer Support Neuroscience Program at the Foothills Medical Center Neuroscience Peer Support Program. Lori?
Hello, like I said, my name is Lori Beaver, and first of all, I want to thank the Council for the award. We are truly honored to receive the recognition and share the honor with the 3 recipients. So our programs at Foothills include Synapse, which is a brain injury program. Roberta Walker is the patient experience liaison, and Roberta had a brain aneurysm 2 years ago. The spinal cord injury program is coordinated by Barry Lindman. Barry had a spinal cord injury 22 years ago. And the Inspires program, that stands for Inpatient Support Program in Recovery from Stroke. And I'm the liaison for that program. I had a stroke, and so we all live the experience in each area. And so the purpose of our program is to understand, enhance, and improve patient and family experience as they journey through the clinical neurosciences acute rehabilitation units at the Phillips Medical Center. So our patients are included with stroke, we have brain injury and spinal cord, and our patient experience liaison peer supporters also provide support for the families of the current patients, and actually we support the friends too. We have monthly peer support group meetings and caregiver group meetings. These meetings are facilitated by the liaisons, and that includes patient and past and current patients and families just sharing their stories and hopes in a very confidential setting. The Improving Patient Experience, this has been a new initiative over the last 5 years at Foothills, and the program began with the stroke program and expanded into the spinal cord injury and the brain injury programs. And so, 2003, I had a stroke, and I was at Foothills for almost 4 months, and at the time there was no one really to talk to who had a stroke that could tell me that you can have life after stroke, that you can drive, you can have a good life after stroke. So many years later, I came back and talked to one of the physicians about possibly doing some volunteer work on the unit. So I started with the acute unit and the rehab, and I'm assuming that the patients were talking about how much it helped them because they developed a full-fledged program called Inspires 2 years later. So that was kind of the beginning for the on the stroke side. So it's basically for patients and families to talk with others who've had a similar life-changing injury, and peer supporters offer hope and understanding. Feedback from patients and families is gathered and provided back to the team to enhance our patient experience for the future patients and families. And so we do surveys and evaluations with our patients and families. The healthcare team and peer supporters are integrally involved in our ongoing initiative. And all of our peer supporters are actually former patients of Foothills, or their family members or caregivers of former patients. They really are the key to our success, and truly they are the heart of our program. And so the neuroscience patient reference group, the objective is again to provide patient input in terms of helping with all the different kinds of things that we do to support our patients. We have representatives from all the 3 neuro areas, and the program is made up of former patients, caregivers, peer supporters, and managers, and they provide advice on surveys, educational materials, strokes, posters on our units with helpful information for our patients and families. And here's a slide with some of our staff for visitation for all 3 programs. And so for each visit that we do, we also support the families and the friends that come to see their loved one, because they are there and they also get comfort from our input and our support. And so we have the number of visits, we have that, but we have no idea in terms of how many people we've impacted other than the patients. We think it's probably in the thousands. So on our peer supports visits, we have 7 acute units, but not all peer supporters are visited by the units. The liaisons go to the acute units, and peer supporters primarily focus on one stroke unit and also the rehab. So you can see that we have quite a number of peer supporters. Our numbers have gone up in terms of number of visits, and that's because we had an increase of peer supporters. So program highlights, again, it's a source of hope and comfort from the acute stage through to discharge. we have many of our peer supporters, they actually had a visit from a peer supporter while they're in the hospital. They want to come back and be part of the program, so, they're really keen on the program. And, with our liaisons, they manage the peer support programs. We do, screening, onboarding, training and supervision. And of course, we also offer the peer support groups and caregiver support groups. And these are some comments from our patients and families. So it's good to know that there's hope out there. Thank you. This peer support was amazing. What a help, inspiration for my husband. Perfect timing. And telling others about their injury and sharing with others helps. And I just want to say that I was on the unit yesterday, and I saw a patient and his family members and a couple of friends were there, and they both said, you know, we really appreciate what you do, both Roberta and I, because it gives such an insight in terms of living with these kinds of injuries, and also you give us hope. And so with that, thank you very much.
Thank you, Lori. It is my pleasure to introduce Dana Delgarno, who is the Senior Quality Assurance Strategist with the Calgary Zone Community Paramedic Program for the Submission Community Paramedic In-Home Blood Transfusion Program. Dana?
Thank you. Hello, my name is Dana Delgarno, and I am the Senior Quality Assurance Strategist for the Calgary Zone Community Paramedic Program. First of all, I'd like to thank the HQCA for this inaugural Patient Experience Award. I'm accepting this award on behalf of the dedicated staff of the Calgary Zone Community Paramedic Program, Calgary Lab Services Transfusion Medicine, and the Tom Baker Cancer Center. In particular, I'd like to acknowledge Joanna McCarthy, Tara Redfern, Ryan Kozicki, Dr. Sidhu, Dr. Shabani Rad, and Dr. Keith Spackman for their hard work and guidance in developing the Home Blood Transfusion Initiative. We're really honored to be receiving this award, as we know there's a lot of work going on by many groups to improve patient experience. So while Calgary Lab Services and the Tom Baker are well-known services, many of you will not be familiar with the Calgary Zone Community Paramedic Program. We are a small but mighty program. Our team of community paramedics work with physicians and other members of the patient's healthcare team to provide access to urgent and primary healthcare by delivering diagnostics and treatments to patients in their home, whether that home be a continuing care facility or a private residence. Some background about this initiative. We should start with a patient story. Just prior to Christmas 2014, we received a call from a Tom Baker physician asking if we could do a blood transfusion in a patient's home. One of his patients needed a transfusion, however, day medicine was closed, and the only alternative for this patient was the emergency department via ambulance. As the patient was very frail, and the family was unable to transport the patient to the hospital. So through this request, we discovered there was a great need for home transfusions. The travel to and from the hospital, as well as the time spent in hospital, is often a very stressful experience for the patient and their family. So we expanded an existing partnership we had with the Tom Baker Cancer Center to include Calgary Lab Services Transfusion Medicine to develop an initiative to provide home blood transfusions, a first for patients in Alberta. The design of the initiative took some time, as you can appreciate, and involved many stakeholders. So improving patient experience. It was important for us to evaluate this initiative. And we used the Alberta Health Quality Matrix for Health, the Alberta Quality Matrix for Health, to serve as an anchor point for the evaluation as well as the development of this initiative. While we needed to ensure that home blood transfusions were safe, we also wanted to make sure they were acceptable to our patients. We wanted to see if the patient experience was improved by receiving blood transfusions at home versus the hospital. We interviewed patients and their family about their experience of receiving transfusions in the home versus the hospital. And we chose to use interviews over surveys because we wanted to obtain rich and detailed information from our patients. We also performed a pre-pilot transfusion to ensure our processes were efficient and to see if there were any last-minute improvements needed. And the picture you see on this slide is of the late Mr. Eckert, a retired RCMP officer, and his wife of nearly 60 years, Mrs. Eckert. So Mr. Eckert was our first patient to receive a home transfusion. And typically, a transfusion in the hospital would mean a 10-hour day for Mr. and Mrs. Eckert, which was incredibly exhausting for both of them. The Eckerts were incredibly gracious and grateful, and in fact, she baked us some banana bread to have received a home transfusion. And most importantly, they reminded us all of the reason for this initiative, improving patient experience. So effect on patient experience. Through the evaluation, there were several key findings we discovered. In terms of safety, it was really important to note that there were no adverse outcomes. In terms of patient experience, the patient feedback was overwhelmingly positive despite an effort to obtain feedback that was critical of the initiative. And as you can see on the slide, these represent just a few of the patient and family quotes. And what you can sort of take from that is that patients were physically more comfortable at home. They felt home transfusions were safe, and it reduced the amount of time needed for a transfusion for the patient and their caregiver and family. These findings were communicated to our team and stakeholders and helped us to make the recommendation that home blood transfusions continue to be part of the services our program offers. So in terms of current state of transfusions for our program, as of May 16th, we have performed 88 transfusions for 31 different patients. Of course, this number has since increased. There have been 2 minor reactions, but they were managed by the community paramedic while on scene. We do look at 7-day outcomes, and there has been no adverse outcomes. And we continue to perform surveillance on all home blood transfusions to ensure safety. And transfusion medicine reviews all transfusion referrals to ensure the appropriateness of the referral. We have ongoing communication between our staff, transfusion medicine patients, and the referring clinics. This feedback ensures continual improvement to our efficiency and effectiveness. So this model of care that we've designed, including the evaluation of patient experience, could be implemented in other zones, and we would be happy to support that work. In terms of future patient experience, we have plans to interview more of our patients regardless of the treatment they receive. In particular, we'd like to interview our patients who are receiving health care while living in homeless shelters to help us determine how we can improve their experience of health care. We'll just close with a photo of Mr. Eckert napping during his transfusion. He received 2 units of red blood cells that day, and what you can't see is that Mrs. Eckert is also sleeping, getting some much needed sleep. So again, I want to thank you for this award, and we're honored, and we like to share it with our patients, their families, and our frontline community paramedics.
Thank you, Dana. It's now my pleasure to introduce our last speaker, Dr. John Ferreira, Program Lead for the Calgary Chronic Pain Centre and President-elect Pain Society of Alberta, for the submission FibroFocus, a comprehensive multidisciplinary fibromyalgia treatment program.
Thank you so much. I am accepting this award on behalf of the Calgary Chronic Pain Centre, its staff, and all of its patients. I'd like to begin with a quotation: "Those who drink the water must remember those who dug the well." And with that in mind, I would like to acknowledge so many people who have made this dream possible. At the Calgary Chronic Pain Centre, our leadership: Connie Burkhart, Susan Baziak, Lori Montgomery, and Chris Vanswick. At Alberta Health Services, Margaret Ovenden. And at Alberta Health, Edwina Villegas and Jeremy Anthony. Thank you to all. My agenda in this presentation will be as follows. I want to present fibromyalgia for what it is, a unique medical challenge. I want to then discuss FibroFocus, our novel approach to meeting that challenge, and then finally spend the majority of our discussion on the patient experience, one that I hope you will find is rich, immersive, and transformative. Fibromyalgia is quite a challenge in the world of chronic pain. Patients with fibromyalgia complain of pain throughout their body. They often have fatigue during the day, and despite this, can't sleep at night. Many, but not all patients also have headaches, low mood, and poor memory. If we ask the question, how many people are suffering with this condition, it's quite a lot. About 5% of women in Canada and between 1 and 2% of men have fibromyalgia. And that equates to 100,000 people in our province, over 1 million people in our country, and 100 million people throughout the world. When we think about fibromyalgia, Canada has taken a leading role in advancing the state of the art. It was Canadians decades ago who helped define the concept, Canadians who helped legitimize the condition, and Canada's national guidelines for the diagnosis and treatment of this syndrome are used in multiple countries throughout the world. And I was very lucky to represent Western Canada in the creation of this document. FibroFocus is, in my opinion, a great program, partially because we have went around the world taking the best of pain treatment strategies. From my 2-year fellowship at McGill to spending a month or more at a number of places, including Brigham and Women's and Massachusetts General, from seeing pain centers in Korea and Auckland, New Zealand, we are trying to build a world-class program by drawing upon the expertise throughout the world. FibroFocus is a team approach, and I cannot stress that strongly enough. Our nurse, Diane Colley-Urquhart, our dietitian, Kelly Sullivan, kinesiologist, Trevor McKay, occupational therapist, Justine Green, our pharmacist, Joyce Cote, physiotherapist, Diane Relas, psychologist, Arlene Cox, Tai Chi led by Kara Hallett, yoga led by Kate Gary, and myself along with the administration staff. It really takes a team to create the kind of patient experience we want to deliver. To understand what makes FibroFocus special requires an understanding of how teams work. There are many multidisciplinary teams in the world of chronic pain, and multidisciplinary generally means individual assessments and individual expertise coming together with the patient as the focus. It is, in a phrase, working in a team. We've taken it a step further to what people consider to be true patient-centered care, and that's called interdisciplinary teams. In a phrase, it's teamwork. There are group assessments and group expertise, and the patient is a team member, and we all work towards common care goals. And in that vein, let us look at this patient experience. The interdisciplinary team meets for 3 hours as part of an introductory patient conference. We get to know the patient, understand their story, which is not a medical history so much as a journey that has brought them to this point. We understand that patients and their pain affects families, and so we invite partners of our patients to some of our introductory lectures. We explain to family members why we can't just cure their spouse and send them home. And because families live together and eat together, we invite partners to be part of our nutrition lectures. And here we have just one example of that. On the left, you have a nutrition seminar that we provided to patients and their families. In that picture, you see commonly used food items, and we've actually counted out the number of sugar cubes in each of those items to provide a visual representation of what people are eating so they can make informed choices. On the right, we have an example of a slide that we show patients regarding improving their nutrition to improve performance. And it's a real-world example, so our presentations have maximal impact. The FibroFocus Patient Experience is a 13-week program, and patients get approximately 100 hours of total treatment in that time. Some of it is in groups, and some of it is one-on-one. In the group environment, all patients have fibromyalgia, and we've seen our patients bond in wonderful and really inspirational ways. Some of our FibroFocus patient groups have their own Facebook page, their own blog, and it's wonderful to see that. I'd also like to highlight that this is an efficient delivery of care because, for example, if I give a 1-hour lecture on the effect of opioids to 12 patients, then that works out to about 5 minutes per patient in terms of resource utilization. So a rich experience, but also an efficient one. FibroFocus involves far more than just medication. We teach patients to be the captain of their own ship, and through self-management, we empower them to live with their condition for the rest of their lives. We talk about sleep strategies and relaxation strategies. We expose patients to yoga and Tai Chi to restore them back to balance and wellness. FibroFocus includes state-of-the-art patient presentations. We ask important questions, like, do patients with fibromyalgia have lower bone mineral density? And we answer the question of what we can do about it. We talk about opioids in a very serious and real way because we understand that ultimately it is patients that manage their own condition. And finally, we talk about nutritional and supplement strategies as well. Everything that you see here is something we want to share with other healthcare providers. We've had interest in FibroFocus from as far away as New Zealand and Australia, but we really want to spread it here in Alberta first. We do this for patients. And here are just 3 quotations from our patients. My doctor told me I'd never feel like myself again. That was a lie. This program helped me feel like myself again, myself with fibromyalgia. Another patient wrote, I never thought I'd be able to get back to lifting weights again. Now I know I can lift, just differently. And finally, I'd given up asking for help. In this program, I learned how to ask for the right kind of help, and now I'm getting the help that I need. It is really these patient stories, their journey, and their improvement that gives us the greatest sense of satisfaction in the FibroFocus program. And with that, I would like to conclude. You will see our contact information in the lower left. Diane Colley-Urquhart, our nurse, as well as myself. If you have any interest in bringing FibroFocus to your patients, or even just taking a part of our content and using it to advance patient care, we would be absolutely delighted. And with that, I would like to thank the Health Quality Council of Alberta for this award. We are truly humbled and honored.
Thank you very much, John. It's time now for questions and answers. If you in the audience do still have a question that you'd like to submit, we have a couple of minutes yet to receive those. One of the first questions that we do have here is a question to all the teams, so I don't know who wants to take this one first. Where do you think your initiative could be best spread to improve the experience patients have in another program, hospitals, or city within Alberta? John?
Yeah, so thank you for the question. One of my goals of applying for the Health Quality Council Award was to spread FibroFocus to other groups. We've already got interest from Grand Prairie, for example, regarding some of our content, interest from Edmonton, Lethbridge, as well as other provinces, and as I mentioned in my presentation, other countries. The goal is to provide efficient care as well as help legitimize the condition of fibromyalgia, and I'm hoping that Alberta will be the place that this not only was developed, but where it spreads widely.
Thank you, John.
Well, this
Dana?
is Dana here. Really, I think it can be spread to the smallest program to the largest program. And really, it is, I know Alberta Health Services has our patient-first strategy, but it really is just simply asking our patients, not being afraid to go out and interview them and ask them questions. And it's really something that any program, big or small, could start doing, and many people are. And we have, a really supportive patient engagement department with, I speak for Alberta Health Services, but it really can be done and should be done.
Great, thanks, Dana. We have a question very similar to that, and it's for Shane. Shane, the question is, great program and excellent presentation, Shane. My question is this: is there a plan to spread this program across other parts of the province? I really hope so.
My understanding from the Strategic Clinical Network for Cardiovascular Heart and Stroke is they've spread it to the communities in Alberta that are large enough to support or have enough stroke diagnosis to support the stroke early supportive discharge. I believe they are looking at using a similar model in some other community rehab or allied health areas in the province. Calgary has expanded into brain injury with their early supportive discharge program, and I really feel that it could also be used for people even who are being discharged from hospital, for example, seniors who are at risk.
Great. Thank you, Shane. And Lori, for your program.
Yes, Lori here. I'm just thinking about the previous question about how can we spread this program, and I think that any area could have a program like ours. It can be, smaller towns could have this program, bigger centers. We've had interest from hospitals in BC, Ottawa, in the Maritimes. We even had a couple of physicians came over from Wales, and we're still talking with them about having, we're collaborating on a peer support program over there. So I think that program is badly needed everywhere. I think it's, any center could have it.
That's great. Thank you very much. We're just checking to see if there's more questions coming through. One question is specifically to John, being a unique program there in fibromyalgia. Thinking of patient experience, what do you think that made your program so successful?
Yeah, thank you very much for the question. We spent a lot of time thinking about what makes for a rich experience. And I think part of that answer is diversity. We don't want to be a purely medical management program where we just give people medications and injections for pain. We wanted to give them psychology and self-management, nutrition, yoga, Tai Chi, sleep group, exercise group, functional recovery strategies. We even talk about mental health, brain health, wellness. We talk about ecotherapy. So I think the ability to have such a rich program comes from the fact that the Calgary Chronic Pain Centre has such a broad diversity of talented healthcare providers.
Great, thank you. That's helpful. I have a question again coming in for all of you to answer. What advice do any of you have to give the other teams who experience a sense of frustration in getting their ideas implemented? So is there something particular that you could give?
Well, it's Lori speaking here. I think that for my program in the very beginning, I think you need a champion to start the program, and you need a very supportive management team. And they'll buy into the program. I think that's what we need to start with. Thank you.
And John?
Yeah, I would say that We are particularly fortunate at the Calgary Chronic Pain Center to have leadership that supports us, and as mentioned in my first slides, support from Alberta Health as well as Alberta Health Services. That said, to get to the heart of the question, I think there's a quotation that is helpful, which is, winners don't quit and quitters don't win. And it is one of those situations where it's about endurance and perseverance, and things don't always go as fast as you would like. Fortunately, because we work in an environment where patients play such a key role in decision making, we always have that inspiration to keep going.
Great, thank you, John. And Dana? The question? Okay, I have a specific question for you again. What other care is offered through the community paramedicine program?
So what we do? We offer sort of two main referral pathways, sort of just in time, so that more urgent care that's required for patients in their home, whether it be suturing, specimen collection, diagnostics such as 12-lead ECGs. We have another referral pathway where physicians can send us referrals for things like IV rehydration, IV antibiotics, blood transfusions, catheter care. So we have a really large scope, but I want to state that it really is in consultation with the physician and the patient's healthcare team. We really don't want to work in isolation of the existing healthcare teams out there.
Great. Thanks, Dana. And I have a specific question for Shane. Looking at with the stroke patients and the patient experience, why is goal setting so challenging, or can it be so challenging with your clients?
After a stroke, some clients have experienced difficulty with insight, so not really realizing what some of their deficits or their strengths are. That can play a role in it. Some of them also have some cognitive concerns. So they may have issues with memory or attention or concentration. And I think we also see on the other side of that spectrum are just people in general don't necessarily know how to set their own goals. So I think that's something that our team can really help out with, is really helping them focus on where they would like to be when we're finished.
That's great, thank you. Important part of patient experience. I believe that's all the questions that we have. So it was really my pleasure to be a member of the planning committee. We had several staff members from HQCA on the planning committee, Cassandra, Macbeth, and Jeanette Jackson, and full support from our leadership, and I thank them very much for their insights and vision for this program. At times it was very challenging for us in trying to design the program and for us to better understand what would it look like in an initiative to see a focus on the patient experience or improving the patient experience. We're, being clinical, we're very used to looking at a clinical process, and this program really focused on that element within the clinical process of saying, how is this experience during this clinical process for each patient? And so it was challenging to sort of set up the program to look at the objectives and how to set out the criteria, but it was also very rewarding, and it was really exciting for us to see all the initiatives come in. We really enjoyed reading about all the great work and all the care that is going on out in Alberta around looking at it from a patient perspective, trying to really address what the patient needs going through that experience. And so we want to thank you very much for that. And on our planning committee, we also had 3 representatives from the HQCA Patient Family Safety Advisory Panel. They were core members of the planning team and were immense help and helped design and develop this awards program. So I'd like to thank Shelley Crook, Byron King, and Geraldine LaRue for your dedication to this awards program. I'd actually like to now introduce one of those representatives, Shelley Cook to provide closing remarks. Shelley?
Thank you, Renda, and it has been a pleasure to work with you on this project. On behalf of the Health Quality Council of Alberta, and as a member of the Patient Family Safety Advisory Panel, I'd like to extend sincere thanks to all those who made submissions to our very first Patient Experience Awards. We are thrilled to see all the work being done by healthcare professionals on the front lines to improve the experience for patients. Speaking from experience as my husband's advocate, I know that the diagnosis and treatment of a medical issue is critical. However, the way that we experience that care is what sets the context for how we view not only the quality of healthcare service, but it also contributes significantly to managing the medical issue. The number of amazing submissions made choosing the winners a daunting task, and we congratulate the folks at EMS Calgary, Calgary Chronic Pain Center, Foothills Medical Center, Neuroscience Peer Support Programs, and the Medicine Hat Regional Hospital and Community for their success. Thank you all very much.
Thank you, Shelley. I would like to once again thank everyone for your interest in the Patient Experience Awards program and look forward to many more submissions about improving patient experience next year. The 2017 awards program will be announced in the new year. Thank you very much. Have a good day.